Recorded.
Hello, I'm Steve with Fitness for 5, Fitness for 10, here with Dr. Nario of Biointegrative Health Center there in Reno, Nevada. You can look them up online, Biointegrative. Hello, Doctor. Good to have you back again for our ongoing series of interviews. Welcome.
Thank you, Steve, for inviting me again.
So today we're going to talk about peptides. I think they're short, long, medium, all that stuff, but what's a peptide?
Well, Steve, this is something big now in the fitness industry, and also you would hear this in the anti-aging communities. So peptides are actually short strings of amino acids. So you have this range specifically around 2 to 50 amino acids. Anything within 50 or fewer actually are called building blocks of proteins. So no peptides, no proteins. So these compounds where 2 or more amino acids are joined together are defined as actually your peptide. Aging and stress, and also, of course, are affected in terms of lowering down the content in your body. So amino acids, actually, I actually would actually say that when you get older, it gets lower. And also when the body starts to become weaker, we also see deficiencies in amino acids and peptides with this. And also when we gain more fat, when we gain more rather than muscle, that is also an indication that we have deficiencies of peptides and amino acids. And also when you see the skin sagging when it's getting when you're getting older, that's another indication for you. And there's so many roles of peptides in your system. Not only this one specifically that I mentioned, but also you would think about neurotransmitters in the brain, and when people go demented and forget things. So they also act like hormones. Not only, so I want to deviate people's mindset about thinking that peptides only for muscle, for exercising, but there's so many things that it's used for, and there's so many different forms in how you administer it. Maybe oral, injectable, creams, and even IV form.
Yeah, this is a great topic. In the clinic there at Biointegrative, I do amino acids with a vitamin drip every other week. So I'm getting a lot of amino acids through an IV. Now, obviously, I mean that's I'm 58 years old. I feel great. So obviously that's doing something for me because I know it's loaded with amino acids along with vitamins, which make peptide chains, right?
That's correct.
So what are the advantages of say me getting these amino acid drips and making peptides?
Well, Steve, that's a good point that you brought up. When you mentioned about amino acids, so we have to segregate that a little bit. So the advantages is going to be, as I discussed this, will show you that answer. The body, when you introduce peptides, as I mentioned to you, I want you to think of amino acids as a bigger molecule, and peptides are smaller. So meaning they combine all together to form that bigger amino acid. So when you talk about peptides, when it is given to the system, it is used immediately. It does not have to be processed like a bigger protein or amino acid compound. And as you know, it needs a less time and effort to process peptides, thus faster effects. Not only do you spend energy breaking it down, but also you would also think about the utilization and how fast the body would accept it. And it's also more stable than what we call an amino acid after they enter the body. And even amino acids, as we define them, are unbonded and are thought to be more unstable than peptides, which means they break off before even reaching the intended destination because of so many enzymes acting against it. And peptides retain their chemical structure better than amino acid. That's why we use the term a better bang for your buck with a peptide supplementation. In the world of sports and even the athletes around us, the use of peptides most commonly are in the objective of faster healing by lowering down inflammation and also increasing the antioxidants in your system to help with the same cause. The ones we use most commonly are the thymosin beta 4s and the BPC 157s, which I will explain later on.
Okay, so what forms can you take these peptides in? Can you take them in, an IV, orally, a shot? Yeah, I think you said that. You can take them in all forms.
Yes, injectables, Steve. So, but the most common ones that we get really or we I use in the practice mostly are injectables for the reason that, as I mentioned a while ago, when you do oral peptides, so you would hear about the most common one out there that I would hear is collagen peptides. Collagen peptides, you will take that orally, but you have to remember again, there's so many things that it needs to go through in, like the gut lining, but the injectable faster but again, way more expensive compared to oral forms.
Okay, so is there any disadvantages of this type of treatment or supplementation?
Yeah, so Steve, the disadvantages really minor points. Healthy individuals unlikely would lead or would have serious side effects. And similar to peptides that we take in every day through food, that's a comparable way on how you think about it. Oral peptide, again, mentioning about a while ago on how much of a challenge for that in terms of raising the levels in your blood is related to the absorption capacity. The body may break it down to individual amino acids. And again, the breakage, you don't know how much will be viable for the body and how much will be wasted. Same time when you have gut impairment, when somebody has bad gut, like even the sign of bloating or just having IBS or even Crohn's disease, already ensures you that you're not going to absorb much in terms of any type of supplement that you take in. Even topical peptides or creams and ointments, they may even cause skin irritations, sensitivity, rash, or even itching. But again, they're rare if you know where you're getting your sources. That's why reputable companies or even pharmacies are the ones that you need. Majority of the ones that you would see in the internet are usually unregulated and they are made overseas. And most of them not meeting the medical sanitary standards. You'll be surprised that even as we explored, I studied the peptides, I've seen pharmacies overseas that look like my college dorm room and it's so dirty. I don't even know how that got out, but these are the things that you have to watch out when you buy stuff in the internet. Majority of the time, when you use these unregulated type of peptides, infections, lower doses of the drug that's inside, use of dangerous fillers that they put in there are the ones that you need to keep an eye on. Generally, the healthy individual still need um, assistance from us professionals for the reason that there could be still possible overdosing. Even proper dosing should be, I guess, advised from your medical doctor. And you need to get reputable sources and majority of the time, compounding pharmacies that we use. And again, the bigger issue, not only for peptides, but also for in general supplements, pregnant, breastfeeding, and even people who are very sick with another illness should still avoid these specific supplements until they speak with their medical doctor.
Okay, the big takeaway I'm getting from that is if you're going to do this and you do it right, and make sure that you're getting a reputable product from a doctor who has reputable sources. That's really, really important and knows, about your blood test and knows you. So that's the takeaway I'm getting from that. So, and it's not really costing more if you do it right, because you're just wasting your money potentially if you do it the other way and harming yourself. So,
Right.
let's say we have a female or male athlete, maybe a basketball player, female or male, or maybe a female or male volleyball player or whatever. But I just picked those sports kind of out of the blue. But let's say they're pretty serious, a pretty serious volleyball player. Are there common peptides or common things that you would do for, say, a serious athlete who wants to be on top of their game and maximize their health? What would you do?
Well, Steve, there are so many peptides out there that we can use for athletes. So just to name a few would be the growth hormone supports, the CGAC ipamorelin, of course, to increase strength and durability during an exercise. Even the growth hormone analogs, these are the ones that I would see, I guess, weightlifters do for muscle gains, the GHRPs, and these are the ones that they usually get through the internet. And the thing here is the most common suggestions that we give for our patients, for actually in every athlete of any type, are always going to be in general. We're going to be I'm going to be giving suggestions not only focusing on one specific sport, but it's just that I want to take away the connotation of bodybuilding in relation to peptides. The thing here is even cardiovascular athletes, such as when you mentioned about volleyball players in basketball, we always also address this in issues of runners, bikers, and crossfitters. The reason for that is the body needs repair from all these wear and tears that they go through. And peptides actually are the ones that would assist from this wear and tear and makes these athletes ready for another round of strenuous activities. So the ones that I will mention can be used alone by itself or as a combination of both. First would be, it's called thymosin beta 4. And thymosin beta 4, as we all know, the thymus gland is a gland that we have as humans also that will release immune cells to help fight infections. But with this one, it was originally found through the thymus calf. I mean, the calf, like the animal calf. And the main use for this is, of course, the immunity and the T cells. But the bonus here, as they found and used it towards immune deficient patients, they saw that the soft tissues are repairing faster. Even the ligaments, the tendons, the muscles are fastly recovering. Sports and even athletic injuries, you would also see stem cell maturation that's accelerated, and it increases the blood vessels for repair. And the thing here is also decreasing the scar tissue. A good example would be when people like tear their rotator cuff. More scar tissue that they get, harder mobility for them. So that's why this is a good peptide to use in those specific cases. Another one is called BPC 157 or body protection compound 157. And this is a weird kind of connection here, but it's found in your gastric juices. And originally it was used for ulcers in the stomach, especially if your ulcer is related to ulcerative colitis or somebody who's taking chronic anti-inflammatories and even alcohol gastritis. But as they were using to heal these ulcers, they also saw another bonus effect. It helps heal the tissues. Same, muscle, tendons, ligaments, and bones were repairing faster than ever. Improves cells survival under oxidative stress. When we're talking about strenuous exercises, we're producing all of these free radicals. It increases the fibroblasts migration, and also those are the healing cells that we have, and also the blood vessel dispersion, and also used in actually burn patients to heal their injuries faster and even corneal injuries. Both, again, peptides that I mentioned available in oral and injectable form.
Okay, last question. I have to ask this. So a lot of athletes, there's so many rules, and they can easily disqualify. Like this deer velvet antler, this is illegal. It doesn't really do much. It's not really giving anybody an advantage, but something as simple as this could maybe get you disqualified. So
Correct.
what about these? Are those okay, in most sports, or do you know? I mean, you may not even know. I mean, you're not, on the board of the AA, what do they
Right.
call it?
The WADA, actually, that's what they call it.
AACC. I mean, the college
World
athletic.
World Anti-Doping Agency. That's what they.
Yeah, okay.
So that's what that's a good question, Steve, because we have so many athletes that we see here. And as you know, the bread and butter of our practice is IV therapy. Now we're talking about injectables. Now we're talking about supplementation. You'll be surprised that even a 100 mil IV therapy given, even just with vitamins inside, before an actual event of an athlete is considered illegal. So that's something that I definitely want to put out there. But for peptides, again, so this is again one of those new things in the market. As of now, as I experienced with my patient, I am not recommending this for people who are in competitions or who are professional athletes, and just for safety reasons, not only for their health, but I'm more concerned about, of course, disqualification from their specific competition. But for the ones who are really interested in finding more about this, is they need to look at the World Anti-Doping Agency's prohibited list. So as an athlete, this is your responsibility, not only for your team, but also for yourself. If you want to make sure that even your own supplements you take orally, you need to check. And you'll find this out also in the USADA.org website.
Well, that's great information. I'm glad I asked that question because, I mean, some of these rules are just overboard ridiculous, but you got to go by them. So anyway, thank you, Dr. Nario, Biointegrative Health Center. If you have questions, you can look them up online. They're in Reno, Nevada. So thank you, Doctor. We'll see you next time.
Well, Steve, thank you again for inviting me. As we all know, knowledge is power, and thank you for letting me provide you with that edge in longevity and health maintenance. So when I call this the biological edge, it's also your bio edge.
Wow, thank you.